Today we will talk about urinary tract infection. A UTI, that is urinary tract infection, is an infection that occurs in any part of the urinary system, which includes kidneys, ureters, bladder, and the urethra. The most common type of UTI is a bladder infection, which is also known as cystitis. A UTI occurs when bacteria from another source, such as the nearby anus, gets into the urethra. And UTIs are more common in women than in men because women have a shorter urethra, only around 4 centimeter, which makes it easier for bacteria to travel from the anus to the bladder. Plus, in women, the opening of urethra is very close to the opening of the anus. So let's know the risk factors for urinary infection. First is sexual activity. So friction during sexual activity pushes bacteria towards urethra. Second is pregnancy. So in pregnancy, the enlarging uterus puts pressure on bladder, causing urinary retention, making it more prone for bacterial growth. Diabetes, especially the uncontrolled diabetes and in which the sugar is coming out in the urine. Fourth is menopause. So after menopause, a decline in circulating estrogen causes dryness in that area, which leads to itching and skin damage, and it makes you more prone for infection. A weakened immune system, blockages in the urinary tract, which could be because of kidney stones or an enlarged prostate in men. And last one, but not the least one, is catheter use. If you're having any of these risk factors, and plus if you are drinking less amount of liquid, it makes you even more prone to get the infection. The symptoms of a UTI can vary depending on two things. First is severity of the infection. Second is part of the urinary tract that is affected. Common symptoms are frequent urination, pain or burning when urinating, cloudy or bloody urine may come out, and there is a very strong odor to the urine, pain in the lower back or abdomen, loose motion, vomiting, and fever. Usually, pain in the lower back or vomiting and fever indicate that infection has gone up from bladder to the kidney. If you think you have UTI, it's important to see your doctor right away. UTIs can be treated with antibiotics, but if left untreated, they can lead to more serious complications such as kidney infection. So now how to prevent urine infections. So here are some tips which can help you to prevent if you are getting it again and again. So first and foremost is to drink plenty of liquids, 2 to 3 liters, especially water. And in a country like India, where it is so hot and humid, it's better to consume 3.5 liters during the summer seasons. Empty your bladder as soon as you feel the urge to urinate. Don't hold it. Don't let it be stagnant there. After using the toilet, especially after passing the motion, you should wipe from front to back, not from back to front. Avoid using scented soaps and douches. Wear loose fitting and cotton underpants. Urinate before and after sexual activity. And after sexual activity, beside urinating, you should again drink 2-3 glasses of water. If you have prostate problem, then regularly take medicines for the same. If you are a diabetic, keep your sugar under good control. So throughout the day, it should be preferably under 180 or 200. So blood sugar more than 180 milligram per deciliter, and certain anti-diabetic medicines increase the sugar leakage in the urine, and they increase chances of urine infection. Reduce caffeine, which is present in tea, coffee, and cold drinks, and alcohol intake, as both are diuretic. Diuretic means they remove water from the body via urine. Sweetened drinks and soda carbonated drinks are known to increase the occurrence of some lower urinary tract symptoms. So, diet sodas alone contain four well known bladder irritants: acidic carbonation, citric and other acids, caffeine, and artificial sweeteners. If you have an indwelling catheter, you must do these things to help prevent the infection. First is clean around the catheter opening every day. Clean the catheter with soap and water every day. Clean your rectal area thoroughly after every bowel movement. Keep your drainage bag lower than your bladder. Empty the drainage bag at least once every 8 hours or whenever it is full. Have your indwelling catheter changed at least every 3 to 4 weeks, and wash your hands before and after you touch your urine. In spite of all these things, if you're having recurrent urine infection, it's better to talk to your doctor about other treatment options such as cranberry juice, probiotics, or antibiotics that can be taken on a daily basis to prevent infections.